for so long to start the show. I mean, look what's happened to me. I'm so emaciated. I'm really big on helping you all train, but let's not get to this. I mean, that's a little ridiculous, isn't it? Good morning. It's Monica Adams. And we're about dead here. We've been waiting for some positivity all weekend long. Okay, it's not real. We are so excited to get ready for Halloween. Look at this set. I want to thank Michelle Harmon for helping out before she left to go to her trip. She's in Malta right now. Yes, can you believe that? She and her mom and some friends enjoying their time for the next week and a half or so. She'll be back with us actually for the Day of the Dead. I think she's going to do the Wet Your Whistle Wednesday with me on November 1st. But the set looks incredible. In fact, do me a favor, drop some comments in the show this morning and throughout the next week. Let us know what you think of the set, because I think it looks pretty incredible. We'll show you different aspects of it. Good morning to you. I'm the real Monica Adams. That was the Bones Monica Adams. That was the fake one. We're so thrilled to have you as part of our show, and we thank Invita Health and Wellness for our Halloween studios for the next couple of weeks. Enjoying every aspect of being here with you, and thank you if you've been here since the kickoff on March 1st, or if you're brand new, well, you're finding out about us, and I'm so glad. Be sure to share and like and follow and spread the word of positivity, because that's what we're here for. It's all about changing lives in the entire world. All that little shift in the mindset, shift in the physical side, shift in the spiritual side. Again, completing the triangle of life every single day. So thrilled to have you. Again, thank you so much. Today, we're going to have one of my dearest friends, Dr. Rick Lehman, the most fantastic orthopedic surgeon. He's with the U.S. Center for Sports Medicine. And I mean, he is the doctor to all of us, as well as the doctor to the stars, the athletes, the celebrities, you name it. He and I used to do a show together on KMOX. We've done a ton of stuff together when I was at Fox 2 and at KSDK. We had a collaboration of Connected Wellness where I send my clients to him. His patients come to me right after surgery or to prevent surgery. A lot of the things we're going to talk about today are alternatives, possibly, to having to go through the path of surgery. So you know or heard about PRP injections, maybe. If not, we'll go a little bit more in depth on that. We'll talk about stem cell treatment as well. You've got knee issues, you've got shoulder issues, hip issues, spine issues, cervical issues, you name it. He is the doctor who I thought was going to retire, but you know what? Everybody just wants him so bad that he's like, all right, I'll still do it, but I think he's backed off a little bit. I want to make sure he's enjoying his time. So if you have some questions or comments or anything that we talk about today, please, again, drop it in the comments. I want to thank my big brother, Brian Adams. You'll see him. Tina Adams as well, my sister-in-law. They're helping out while Michelle is in Malta. So if there's any comments that you have or questions, he will drop some links for you, and I want to thank him so very, very much for doing that for me today. 7:03, and I want to give you a little rundown of some stuff coming up in the next couple of weeks. First of all, the big event on November 4th. There's only about 23 tickets left, okay? And then it's going to be a sellout. So get on these tickets. I know a lot of people wait to the last second. I don't want you to do that. If you haven't heard us talk, it is 6 to 8 p.m. November 4th at Clayton Winehouse. Now, we do your Wet Your Whistle Wednesday, brought to you by our friends over at Clayton Winehouse. I want you to actually get a chance to see it. That night, you will. And it's all going to be positivity. It's going to be giving back. It's going to be great food, drinks. So the food's from Trattoria Marsala. Thank you to Christine and Jamie and Steve Komarek. The food is going to be amazing. Those, again, they're so well known. They're raviolis, I'm going to say, are probably the best that you will ever have in your life. We're going to have those. We're going to have chicken spadini. We're going to have some meatballs. All Italian food for you. And then whiskey. And then wine tastings. If you don't drink, that's fine. We'll get a little mocktail going for you. We're going to have live auction, silent auction, and all the proceeds going to Yuppie Puppies Forever Rescue. And by the way, the list of items, incredible. Thank you to Mark Abel and the staff over at St. Louis City SC. We're going to be putting a basket together from there. Bruce Affleck, thank you so much, from the St. Louis Blues. Thank you to former Blues enforcer Reed Lowe. He's got an incredible wine flight he's going to be providing for us. We have an 8-person reserve tasting with Chuck Gillentine from Defiance Ridge Vineyards, and a farmhouse, kind of a farmhouse dinner It is a fall harvest dinner that you get for 2 people, and that's also from Defiance Ridge. So, Chuck, thank you so much for that. We have a trip to Grand Somar Land's End at Cabo San Lucas. That's from me and Jim. Cannot wait to see who gets that. Kathy Kilo Peterson is donating a weekend stay for 6 people in Pacific at this beautiful cabin, including an incredible chef-inspired dinner and a little boozy slush I'm told is going to be there. BioFit, a new way of training. We've got a month membership to give away to 2 people, and more and more and more. I'll be dropping those in. I do want to thank our sponsors, Invita Health and Wellness, Kathy Kilo Peterson, Diamond Roofing. Thank you to Katie and David. And then Mark Anthony's Gifts and Spa, Christopher's in Kirkwood. Thank you to Mark Coulter and Michael Clausen Realty. Of course, to Clayton Winehouse and to Trattoria Marsala and 1219 Elite Events. So we're pulling this incredible thing together. Started off as a small little idea, and it is growing and growing and growing. So you can get your tickets right now. TheRealMonicaAdams.com. Click on what's new, and there it is. There's the event, an evening with The Real Monica Adams. Tell your friends, grab your spouse, grab the girls, maybe a guy's night out. You don't want to miss this one. And then we'll have other big ones coming up in 2024. But this is my first big event because you believed in this show. Our sponsors believed in it. If it wasn't for all of you, we wouldn't be able to do this show on a daily basis. So thank you so much for being a part of it. All right, I'll look at some of the comments again about the show, about anything you want us to talk about. Always email me info@therealmonicaadams.com. Let us know topics that you would like us to talk about, guests you'd like us to have. It's as easy as that. All right, 7:08, and like I said, we have a special guest, Dr. Richard Lehman from the U.S. Center for Sports Medicine. We're going to talk about all things body. Not these bones and these crazy things that are behind me, but I'm sure he has those in his office as he tells us about the knee. Look at this little guy I have here. See, I can look at the body. It's like an anatomy chart. A lot of bones. Dr. Bones, Dr. Richard Lehman will be in the blue chair when we return. Invita Health and Wellness, where you can feel your best both inside and out. Invita isn't your typical med spa. They're a multi-specialty medical spa and wellness center serving St. Louis and its surrounding areas. They have ketamine for mental health and pain, IV therapy, medical weight loss, and aesthetics treatments. As board-certified anesthesia providers, Invita can ensure that their advanced treatments are provided safely with minimal to no pain. So let Invita take care of you. Call 314-394-0950 to book an appointment or online invitahealthandwellness.com. And welcome back to the Real Monica Adams Show. Isn't this fun? I mean, look at the set. If you're just tuning in, it is such a blast. We did all this. We were going to debut it yesterday, but we did the show from my house yesterday. And thank you again to Dr. Charles Willie for joining us from South Carolina. It is 7:09, and we're going to kick the show off. We've got a lot to talk about today with my friend, Dr. Richard Lehman. Great to see you again.
Well, good morning. It's great to be here.
Isn't this fun?
This is awesome.
I mean, look at this. We're creeping it real, folks. It's all about keeping it real. It is good to see you. Always. You look fantastic. He's so fit. What do you do, by the way, for yourself to stay in such great shape?
Well, I'm pretty boring. I lift every day. I follow your rules, really.
I love it.
And I do MVO2 cardiovascular training and heart rate monitor, the whole deal. And it's a pretty stringent program, and it's been great.
So for you, and I go, there's a lot of people in your industry that although they preach it, they don't, and they teach it, they don't necessarily do it. It's important to you. Why?
Well, first of all, I think when you look at Huberman and some of these guys, and I know these guys because they're doctors. We give the same talks. We go to the same programs. We've had dinner, and when you talk to them, they're looking at quality of life. Not only just longevity, but how are you going to be in the last 10 or 15 years of your life? Mm-hmm. How healthy you're going to be, how active you're going to be. And it really comes down to all the things that you've taught me over the years, and that is strength, right? It's trying to stop sarcopenia, loss of muscle mass. Number 2, MVO2, which is directly correlated to longevity. And what that is how you process oxygen, so how fit you are. And number 3, probably most importantly, is all your vital signs, so your blood pressure, your cholesterol. And I think if you monitor these things, so you're eating fairly well, and you don't have to get crazy, but you work out. If you look at the number one thing that's going to make you healthy in the last 10 years of your life and improve your longevity, it's exercise.
Absolutely. Well, it's the whole thing. You know about the whole triangle, right? It's making sure your mind's right. You've got a lot of patients that you have treated over the years that when they find out they have this injury and they are trying to work out and then they do it wrong because they're not working out with a good trainer, they get lost in the gym, they injure themselves, and then they get really depressed. So then that part of the triangle is off. I'm sure that's a big part of a lot of the patients that you've had is, well, doc, I don't want to have surgery.
Well, that's right, and I think the mental part is underdeveloped, and no one really talks about it. But that's a big component, and it's a big component in our pro athletes, because when you see somebody on their A game, and they just look like they're training hard and they're working hard, and you see somebody for some reason who's got a hamstring pull, who's got a knee injury, and all of a sudden it's not that their knee just hurts, their whole mental status, their whole countenance seems to just decrease, their training patterns go poorly, and then all of a sudden, they just can't perform, and you see this over and over and over again.
It's interesting. You and I have talked about this in the past, and we've even talked about standing on stage, doing a little motivational speaking, and not just to the athlete, but it's multiple levels. You're going to see yourself in this particular comment. You could be a CEO of a company, you're a president of a company, you're a high-end doctor. Suddenly that's taken away from you, and then the depression sets in because you're like, well, what's my identity anymore? You see it in athletes, whether it's high school athletes at the top of their game, and then boom, an injury takes them out. The collegiate athletes, the pro athletes, suddenly they're like, well, who am I?
And I think you talk about CEOs, so much of your identity is wrapped up into who you are, your business, your day-to-day activities. And so when that is taken away, that changes. And an athlete who's on the disabled list is a completely different athlete who's playing every day. And as a team doctor, you just can tell talking to these athletes when they're injured, they're not part of the program, they're not on the field or wherever on the diamond, they're completely different, and their attitudes are different.
If you're just tuning in, Dr. Richard Lehman, very dear friend of mine. I don't even know. We've known each other for a very, very long time. He actually did my left shoulder surgery in the beginning of my career when I was down in DeSoto. I was in a bad car accident back then. Car accidents seem to keep following me, Rick. I got to stay away from these things. But he did my surgery, and that was back in '95. I think that's how long you and I have known each other.
Yeah,
and then we developed this wonderful professional relationship. We've done tons of shows together. We connected together, though, because he is who I respect from an orthopedic standpoint, and that he respects me from helping his patients. Many times you'll send the patients to physical therapy and then say, okay, but I want you to get to Monica as quick as possible.
Well, and you've also trained a lot of my athletes, so you've done great post-op, that's true, but also a lot of the athletes that you've trained have really flourished. So I think it's a great relationship because you're very positive, you understand sort of the triangle, and all trainers aren't the same.
No.
I don't want to bash any trainers
sure.
here, but all trainers aren't the same, and I think you really have a way with people, and you know who to push, who not to push, and it's just been a great relationship.
Well, thank you. We were just looking at a picture there. That was actually my husband, and Rick actually did take care of his knee. We can go back to some of those pictures. I appreciate him. That was a photo shoot that we were doing, but you actually have treated him. You did surgery for him, but we also talked about blood flow restriction therapy. So we're going to talk about a lot of different ideas today that maybe you've heard about, but you didn't know a little bit more in depth. In that picture, we were actually discussing with him, here's options that you could go through. You try as much as you possibly can before you actually have them go under the knife.
Well, I think a sports medicine doctor is different than a lot of doctors in that it's almost counterintuitive, but we don't want to operate on people. Mm-hmm. So total joint guys, they want you to replace your knee, they want to replace your hip, but sports guys don't want to operate on you. So we are as cutting edge as we can possibly be trying to avoid surgery. And the reason is, if you think about it, you do a Tommy John surgery, it's going to be a year. So if you could PRP someone's elbow and they're back in 4 weeks and you gain 11 months, that's huge, especially when you're paying someone $30-40 million a year. So again, your sports medicine doctor should be your friend in such a way that he's going to try to avoid operating on your whatever.
Absolutely. Well, I talked a little bit about it. So you want to go a little bit more in depth. I think we've mentioned it in the past, or maybe it was on one of our radio shows, but blood flow restriction therapy. What is that? How long has it been around? And who do you think is a candidate for that?
Well, BFR is new. I mean, there's no question about it. And it's been around for a long time because guys in the gym figured it out, 50 years ago, and they would tie bands around their arms and legs, and they realized what was happening. And then probably 2, 3 years ago, science kind of took hold. And the principle is this: when you're lifting weights in the gym, why do you do 10 reps? You do 10 reps because what happens is in the ninth and 10th rep, you fatigue, the muscle shreds, the muscle breaks down, and the healing of the muscle is what gives you volume and strength. The first 7 or 8 reps are just breaking down the muscle for that ultimate failure. And you want to lift to failure. So if you think about it, if you take all the blood and all the oxygen away from the muscle is failed with every rep. So every single rep is a max rep. It causes shredding, and then you get hypertrophy or healing. So what we do is we put a tourniquet around your arm, your leg, your calf, whatever. We put the tourniquet up to 80% of your systolic pressure. We then give you these ridiculously easy exercises to do, but you can't do them because you have no oxygen in your muscle. So people are just like, first they're like, this is stupid, and then they come in the next day and they go, I couldn't even lift my legs. But you see hypertrophy, it's crazy. And if you think about it, if you have a bad knee, let's say, and you have very simple exercises, if I said, all right, Monica, you have a bad knee, we're going to do squats with 600 pounds, you'd be like, well, I can't even squat my body weight. But if we take away all the blood flow and all the oxygen and give you very minimal exercises that don't stress your joint, then at that point you're going to get maximum hypertrophy. Again, your quads, your calf, your upper body, whatever, wherever we're restricting. And it's a very simple way to really gain strength and to really gain mass.
Let me ask you this question, because there are people who will just go into the gym, they'll just lift, they'll do the same thing over and over and over again. I'm going to guess you're like me, where you like the body to be forced into several different things. That's why I like triathlons. Instead of just constant running or just constant cycling, it's this transition of the sport. So it's not such constant on one particular area. And you see a lot of runners that come back, they have ulcerated heels, they've got knee issues, hip issues, spinal issues, neck issues. But then all of a sudden they're like, well, I still want to run. Well, maybe I can get myself into a transitional sport. From a lifting standpoint, there are people, and I know there's some gyms that want you to maybe work out once or twice a week, but in that, as we're talking about, it is all out max. So like the 20 Minutes to Fitness, BioFit, John actually, who owns BioFit, he is donating something to our big event on November 4th. We went over there and tried it, and I'm like, oh, wow, this is really difficult. What are your thoughts on that type of training?
Well, so I'm a big fan of lifting to max, and I'm a big fan of HIIT exercises. Okay. So you and I can go for a walk, and we can walk for 5 hours. We may not really improve our fitness, but if you and I go to the track and we run 10 40-yard sprints or 100-yard sprints full gas, you're going to have a training effect. That's going to be a big training effect. So I think when you're in the gym, and again, you have to think about it. If you're 22 years old, you're an NFL football player, and you're going to do max reps of 1 or 2, that's one thing. If you're 60 years old, you're going to have to bump your reps up because you don't want to get hurt. But I think in a training effect, you have to push the iron. And you said something that's really very important. You may have missed it. You probably didn't miss it. But you have to trick the body. Yes. So if I go every day and I do the same workout every day, I'm going to accommodate, right? I'm going to get good at it. And I'm going to get efficient at it. That's why walking doesn't really help you that much unless you're trying to walk fast, because you're too good at it. So what you have to do is you have to trick the body. So you want to change up your exercise regimen. So when you're talking about a triathlon or a runner who, and I'll tell some of these athletes, man, you're breaking down. You have to cross train. You have to swim or ride a bike or get on elliptical. You just can't go 80 miles a week, 70 miles a week every week. You're going to wear the car out. So your point, which we didn't really get to, but we're getting to now, is you have to change your workouts up. And so a triathlon's perfect. Even if you never do a triathlon, swim one day, ride a bike one day, get on elliptical one day, 2-3 days a week. Resistance training is a must. Everyone in the world, everyone listening to this podcast, everyone should resistance train. I don't care if you're lifting 2 pounds, you have to challenge your muscles.
Well, and one of the things I'm big on, and I wish more and more men, and I think they are, it seems as though you have to get to a certain age, and then guys are like, ooh, I can't train like I did anymore, but if I do, maybe I listen to the women around me that say, introduce yourself to yoga, introduce yourself to Pilates. I'll never forget Isaac Bruce telling me, what in the world, why are my legs shaking so much? This is crazy. Why are all these other women around us able to do it? But his training was always one particular way. And then all of a sudden you've got this incredible athlete introducing themselves to something that seems foreign to them. And they're like, well, why can't I do this? Well, it's all these different muscles that were never used before, right? The intrinsic muscles, the smaller ones.
It's insane. So I remember my first yoga class, and it was so embarrassing. So you had all these women, and it was me and a buddy, and my buddy was actually an NFL football player. I couldn't do any of the exercises, and the things these women were doing, I wanted to stop and just take a picture. So the way I was doing it and the way they were doing it, you'd think we were in two completely different GPS zones. I mean, it was crazy. But you're 100% correct. And if you're looking at flexibility, or you're looking at central core strengthening, Pilates, yoga, dance, I mean, a lot of these balance. I mean, I've got guys now doing these balance, they call bar A, whatever you want to call it.
Yes, I love bar classes.
And they're like, Doc, I'm not going to that. But after 2 classes, they come in and they're going, hey, I was embarrassed. I couldn't do anything. I'm going back tomorrow. This is terrible. But that component of flexibility is a huge premium in the NFL. It's a huge premium in the NFL, NBA, Major League Baseball, every sport. And if you look at hip rotation in a soccer player, hip rotation in a professional tennis player, that's just money. And so if you think about it, that is just what we're talking about. That's that cross-training. That's that component that we don't have.
Right. So if you have to figure out on your own, by the way, you have to figure out how many days a week are you wanting to train realistically. And then you want to drive towards that. But if you want to do resistance training and then you break it up with some stretching, you do some yoga, you do some Pilates, you do meditation. It's all those things. Just watch how the shift happens in your life. Before we take a break, semaglutide. This is something that Dr. Sarah Franco actually is going to be talking about with Invita Health and Wellness, and a patient of hers, Mary Ellen, who we'll be featuring soon. I saw you in an article back in December of last year in Fox News talking about athletes and if they are needing to drop weight quickly, that there are physicians that would maybe prescribe that. But we want to talk about the fact that people can't just have injection and then not ever train, right? And then they're like, well, why do I still feel fat, or I don't like the way my skin's looking? I'm not doing. You can't just have a shot and then just think that's how you live your life.
Well, so semaglutide's going to go the way of phone booths, and it's just not going to be around anymore because there's been so much progression in the space. The next thing that's coming is an oral mix that's going to be probably 15-20% better than tirzepatide, which is Mounjaro. And so there's a huge expansion, which you could understand because, everyone in the world wants to take this stuff. So there's so much money involved in developing these drugs. So I know of 2 or 3 oral drugs that are coming out that are going to be, they're GLP-1 agonists, which is what semaglutide is, or GIP drugs. And so these drugs are going to stop gastric emptying. Everyone's going to lose weight. The problem is losing weight can be one of 2 things, right? You can lose muscle mass,
Sure.
which you don't want to do,
right,
and you can lose fat, which you do want to do. I get a call, I would bet you, 3 times a week from bodybuilders. They all want to go on semaglutide. Now they want to go on Mounjaro because they want to lose sub-Q fat, and that makes their muscles look ripped, right?
Yep.
So I got guys that are professional, and I can't mention their names, that are professional bodybuilders. They're almost all taking semaglutide right now. And the reason is they're lifting, so they're maintaining their muscle mass. So if you're out there and you're losing weight and all the muscle mass is going and your fat is staying, i.e. you're losing pounds, but you're not losing just fat, this is really important, then you're losing muscle mass. You are getting fatter. You're getting lighter,
right,
but you're getting fatter. Your percent body fat's going down. So what do you got to do? You got to lift. You got to lift. So everybody out there who's listening, if you're and you know what? You should take semaglutide. People that have BMIs over 25, the healthiest thing you can do is lose weight. There's no question about it. Diabetes, high cholesterol, longevity, just go through every cancer. Every disease process gets worse when your BMI goes over 30. 25 to 30 is a gray zone. But you have to you can't just lose muscle mass. You have to train. You have to lift.
Yeah, it's okay. For those of you that, and I want to go a little bit more in depth into this, for those of you that haven't heard about it, so there are multiple ones that are out there. There's the true ones for diabetes, then there's ones that are prescribed specifically for weight loss, but a lot of the diabetes patients got very upset because people are taking it and then suddenly it's not available to them.
Right, so the semaglutide drugs are Wegovy,
Wegovy,
Ozempic, etc. The new one is Mounjaro. There's going to be a new one out by the end of the year. And these names are whacked. You can't even pronounce the names of these drugs. But anyway, that doesn't matter. You'll figure it out. But yeah, there was a shortage because all the diabetics couldn't get their drugs because all the people were losing weight. And then really what ended up happening is it hit the celebrity status.
Yes.
And then, then everyone's like, well, how did so-and-so, how did Adele lose all this weight?
Was she on that?
I don't know.
Well,
they're
they're also questioning whether Kelly Clarkson, all the weight that she just lost. Everybody's saying that, and I'm like, well, until it comes out of her mouth, and if she wants to endorse something. But I think right now you're right. Every celebrity, every actor that loses weight, they immediately say they must be on fill in the blank.
Right, and if you ask anyone who's lost weight, they're going to say they're eating better and they're exercising. But let's be fair, they're not selling whatever it is, $4 billion a quarter of this stuff, and no one's taking it. Everyone's taking it.
Right. So what about, okay, we're going to take a break. I'm going to ask you about side effects of it. If someone is wanting that, they're coming to you and asking you to write a prescription for it?
Sure.
Yeah? Okay, we'll take a break. We'll talk more about that. We have to talk about PRP injections. We're going to talk about stem cell treatments, all that. And if you have any questions, I'll look down at your comments for Dr. Lehman. Let us know. We'll have more right after the break. Hi, it's Monica Adams. Thank you so much for following along with The Real Monica Adams Show since we launched back in March. But I wanted to let you know there's so much more that I could do with you, your business, your corporation. Did you know that I'm a motivational speaker all around the world, as well as an MC and an auctioneer? So if you have an event, maybe a nonprofit organization, and you want to book me, just shoot me an email, info@TheRealMonicaAdams.com. Personal training, life coaching, and styling as well. info@TheRealMonicaAdams.com.
Just getting fat.
And welcome back, 7:27. You're tuned into the Real Monica Adams Show, and we're talking about real talk today on our fun set. Don't you enjoy it? This is the first reveal of it. We were hoping to do that yesterday, but we'll have this up for you for the next week. And again, thank you so much for Michelle. She was the one that helped to decorate the entire set. We're visiting with Dr. Richard Lehman, U.S. Center for Sports Medicine, doctor to the stars, doctor to all of you, incredible sports medicine doctor. And we're talking about semaglutide and Wegovy and all those. So yes, there's a lot of celebrities. I think the Kardashians are the ones that everybody jumped. Oh my gosh, look at how are they losing all this weight? And then you can name any celebrity that's out there that you can see that they've dropped weight and figure, well, they probably took that. But what are the risk factors? What are the side effects that people need to know about?
Well, so in the beginning, the big problem was dosing. So they came in a arranged dose, and everybody was it's an injectable. Mm-hmm. These drugs are injectable. The next iteration is going to be oral. And basically you get the injection, but you have to titrate it. No one really understood that. So a lot of people just injected it because that's what you're supposed to do. And if you were diabetic, that's what you did. But it stops gastric emptying. And so if you eat and your stomach isn't emptying, what's going to happen? You're going to throw up. So they had a lot of people with nausea. Some of the things to worry about are parathyroid and thyroid tumors. You have to be careful, pancreatitis. So there are some side effects, and you have to pay attention. You have to get thyroid studies, you have to question them about their pancreas, etc. So there's definitely side effects. But I think that can all be corrected by appropriate dosing. So we start the athletes out, or the patients out, most of them are athletes, on 0.25. And the way this really got started in my practice was we had professional athletes, mostly football players. They were going to go to NFL camp, and if they're overweight, they get fined. They can't show up. You can't show up to NFL camp or Major League Baseball 100 pounds, 50 pounds overweight because you've been eating the whole off season. So they would be like, well, I got 6 weeks. I have to lose X amount of weight, and we would treat them. Mm-hmm. So we would titrate them and start them on a very low dose, 0.25 milligrams a week. It's an injectable. And everybody out there, you can barely feel. I mean, the needle's so small. Don't worry, it's fine. And so then we would bump it up to 0.5. But if you look at some of them, some are 1 milligram, so 4 times the dose, and then some are 2.4 milligrams. You know, and basically that's 10 times the dose. So if you take too much of the stuff and your stomach doesn't, your gastric contents, your stomach doesn't empty, and you have this insulin because it's controlling your insulin, you can get sick. So what's the key? The key is, one, we just talked about it, you got to exercise. Number two, you got to hydrate. No one ever talks about this. You got to hydrate when you're on these drugs. Drink water, electrolytes, Gatorade, doesn't matter. You got to hydrate. Number three, and this is key, when you're taking these drugs, you have to eat very little. So you're not really hungry, but some people eat just to eat. Like, people that are overweight, and there's been a million studies, and I think most people that are overweight, you know, everybody says, oh, you eat too much. That has nothing to do with it. These people have a genetic issue. There was just some markers that were identified in Germany, I think, where they looked at 6 or 7 DNA markers, and it's a genetic problem. It's an environmental problem. So to say, oh, you just don't have, you know, the willpower. They looked at people who are on The Biggest Loser. Your body wants to gravitate towards that weight. So you have to do something to change your basal metabolic rate. So you have to work out. You have to do cardio. You have to lift. So the side effects are problematic. You have to pay attention, but I think a lot of it can be controlled in dosing.
Okay, so if you want to go a little bit more in depth into that, again, do your research. You can talk to doctors, have your labs done to see where you are with your A1C. Or, you know, do you have genetic background? Does your family members have diabetes? We're talking type 1, type 2. Again, just look into it. I just wanted to throw it out there. We always want to give you a little information. I want to talk about PRP injections. There's a lot of patients, a lot of clients of mine that have come to you. They've gone to physical therapy. They're trying everything they can to avoid knee surgeries. So first, talk about what PRP injections are. And somebody was asking, they're like, I couldn't wait to listen to the show because they're starting it, or they're thinking of starting it with their doctor. And they said, well, how often, what's the dosing, etc.
So platelet-rich plasma is a very simple concept. Number one, why does your body heal? What makes your body heal? And the answer are these things called cytokines, or proteins that float around your body. They make your skin heal when you cut yourself. They make your bones heal when you break your bones. And these are inflammatory markers that recruit healing cells. So if you have arthritis in your knee or torn meniscus, whatever, and you could recruit all these healing cells into one place, i.e. your knee, let's say, then you could change the environment. You may not heal the meniscus, but you're going to change the environment, stop the inflammatory response, and improve the mechanics of the knee. So practically what it is we draw your blood, we take it, we put it in a centrifuge, we spin it down, we take out the plasma cells, we hyperconcentrate these things called cytokines. So there's growth factors, growth hormones, cytokines, and we inject them into, in this case we're talking about the knee, into the knee. Now, that was kind of phase one of PRP. We've been probably doing it 10, 12 years. Started out with pro athletes. Tiger Woods made it very famous. And it was kind of state of the art. But as most things in medicine, and certainly everything in sports medicine, it is sort of mutated. So what we're doing now is we're using either umbilical micronized placental cells or micronized umbilical cells, because what we want to do is we want to get these immature cells that can grow up and be, you know, and it depends where you put them. If you put them in your pancreas, they're insulin cells or pancreatic cells. If you put them in the knee, they may become cartilage cells. If you put them in the heart, they can be myocardial cells. So they're little baby cells, and they're going to grow up to the environment that you put them in. So now we're kind of past PRP a little bit, and we're sort of into the second or third edition in terms of what we call orthobiologics, and we call them complex orthobiologics because we're compounding not just the PRP, but we're trying to add other nutrients to whatever we're injecting, the knee, the shoulder, the hamstring. Probably 3 times a week I'm injecting high-level athletes with hamstring injuries, enhancing the healing. So we've moved beyond the PRP a little bit, and I think we'll continue as research improves to get better and better at these quote-unquote biologics.
Well, I was looking on your page last night before I went to bed, and I saw a very dear friend of ours, John Pertzborn from over at Fox 2. He did a video. Was that back in August?
Yeah.
So he's trying to avoid surgery?
So what happens? Let's talk about practically. People come in, they say, well, I went to my doctor, they told me I had a torn meniscus, and they said I need surgery. I don't want surgery. So what do you got? What can you do for me?
What do you got?
What do you got?
Doc?
Right. And so, which is a common thing. And so in a sports guy's practical world, it's week 11 of the NFL season. Miami Dolphins are in the hunt. The running back has a torn meniscus. If he has surgery, he's going to miss the rest of the season. So, they fly him to St. Louis and they ask that exact question, what can we do?
What's in your bag, Doc?
Right. And so very few people walk into a sports guy's office and say, I can't wait to have surgery.
No.
Right?
No one says that.
No one says that. So what do they say? They say, what can you do for me? I don't want to have surgery. And so, again, that's what your sports doctor should be good at. And there's lots of great sports doctors. So what we think you should be doing is a combination of training, maybe sending them to Monica Adams, training. Number 2, you want to do something to change the environment of the joint, orthobiologics. And we're very, very big on this BFR, and you and I kind of got into it, talking about it, I don't know, it's probably been 6 to 9 months. So these things help you get over the hump to avoid allow you to train to avoid surgery so you can continue to train. And, people like John or people who come in with torn meniscuses generally don't want to have surgery.
And John was a big runner. So he was saying, maybe it's from all the marathons that I did, getting to that point. So that was done back in August. Have you just done one PRP injection?
Yes.
So I think that was one of the questions that a lady asked last night that wanted me to pass along. She said, if I have it done, what should I be feeling? When would I feel relief? And how many do I have to have? I think you said that in the video with him.
Great questions. All great questions. So number 1, and I tell everybody this, and I've been burned a few times, usually you get a pretty bad flare. You're injecting blood products into a joint and usually get a pretty bad flare. So I tell everybody you're going to have 3 or 4 days of, misery. I had one situation where it was the CEO of a very famous company. He was getting on his plane and I teed him up. I injected his shoulder. I can't say who it is. I injected his shoulder. He was getting on his plane to go to China for a meeting, and he called me every hour. And he kept saying, I don't feel anything. I don't feel anything. I didn't get this flare. Is it working? So everybody out there, you're probably going to get a flare. You're probably going to feel terrible for 2 or 3 days. You may not get any flare. It doesn't make any difference. This guy was cured. He came back. He goes, I've never felt better. I talk to him all the time about other stuff. Never had a problem with the shoulder after that. But generally, be ready. You may have a few days of, wow, why did I do this? And then it goes away. PRP is different than a cortisone injection. You get a healing response, so it's a slow ramp. It may take 6 to 8 weeks to get better because you're getting healing. Cortisone gives you a big up and a big down, and it's an anti-inflammatory, but nothing's going to heal.
So is it possible people would have a PRP injection? Oh my gosh, finally relief from this horrible pain I've had. Now I've gone on about 6, 8, 10, 12 weeks. Okay, now I'm starting to feel again. Would you do a PRP injection again or no?
That's probably not going to happen because the bump up you get is usually permanent. Okay. So you get the up, you don't get the down. Generally, the paradigm in the States is 1 injection, maybe 2 injections. Now, in Europe, they will do a series of 3 weeks apart. We have not found that to be all that better or all that helpful. So we did a study. We looked at a series of injections versus 1 injection, and to be honest, at 6 months in a year, not much difference. So I would say, let's say you had 80% improvement from a PRP, and you said, I wanted to knock out the other 20%. I'm still a little sore. I can do all the things I want to do, but I'm still a little stiff. I would say, yes, you should have a second PRP. Or let's say you came back in 2 years and you said, look, I did great. My disease, my arthritis has progressed a little bit. Have a second PRP. But generally, it's 1 or 2 shots.
Okay, so PRP, if that doesn't work, what other levels would you go to before you absolutely say, we've exhausted every level, now it's time for you to have surgery? What other processes would you go through?
So I'm a huge believer in these micronized cells, or live cells. Now, we can't do live umbilical cells in the States. We do have a process where we send people, it's going to sound terrible, to Costa Rica, and they do live umbilical cells. It's against the law in the States. We can't do it. There's some research in Germany, so there's a doctor in Germany who also is doing this Regenten, which are these cultured cells. Now, having said that, my next step, because we live within the laws of the United States, are micronized placental cells, micronized umbilical cells. So they're getting all the good from the cell. They're taking out the live DNA, so you're not going to get any kind of allergic reaction. And my next go-to would probably be a micronized stem cell pattern. Now, there's lots of other ways to get stem cells. I mean, the other thing we do in the office, is going to sound terrible, is we do this mini liposuction, which there's many stem cells in fat. So you have somebody who has a little bit of extra adipose tissue, which sometimes is problematic because a lot of these athletes don't have any. We do this mini liposuction and we inject the substrate into the knee. So there's a number of ways to get stem cells, but if you said, what's the next, I don't really want to have surgery, what's my next option? What's on the menu here, Doc? The next thing would probably be some type of stem cell pattern.
Is that the entree?
That's the entree. But this is changing.
Yes.
And this
Well, I was
is
just going to say, because you're talking about placenta and umbilical, were those things in other countries? And if so, how many years ago? And then it's into the United States. So what
No.
do we? No.
No. So in the other countries, so these are Americans that went to these countries to develop these patterns because they couldn't do them here. This is American medicine. Johns Hopkins very involved, etc. And so they know they can't do it here, so they're setting up centers. And some of the centers, Colombia, there's a number of them. There's one in Cabo, are just big multinational corporations that have these centers. But sports medicine is on the cutting edge. So what we're doing today, we're not going to be doing in 6 months.
Right. So if we're seeing these things in other countries, they maybe are right around the corner for the U.S.?
Well, that's going to be a political decision made. Are we allowed? Are they going to let us infuse live umbilical stem cells? Now, it sounds terrible, right? Like, oh, what are you guys doing? You guys are nuts.
Well, that was the whole controversial thing when stem cell therapy came out in the first place, right? It's which line, but I mean, you look at the advancements in medicine, and here you are, a physician, very well respected, saying we need this.
Absolutely, because that's the iteration. That's the next step, and I think as things progress, we need the freshest, healthiest cells. These women are tested. They have babies. They're not giving up anything, and basically they're signing a piece of paper, they get paid, and we're going to take, the umbilical cord. And what do you do with it if you don't sell it? You give it away. You throw it out, right? It's not good for anything.
Well, I was just going to say, it's either going to get tossed or it could completely change someone's life.
Absolutely.
We're going to take a quick break. We're going to look at your questions, and we'll talk more with Dr. Richard Lehman from the U.S. Center for Sports Medicine when we return.
It's the icing on the cake.
The final brush stroke.
The finishing touches make all the difference in your home, too.
Have fun and get started at carolhouse.com/room planner.
With thousands of accessories in our 3.5-acre showrooms.
Get your picture perfect room and the lowest prices in the country at Carol House.
Because you like nice things.
Of course, it's great to get outside and enjoy the warm weather, but when it's time to relax indoors, be sure your home stays cool with equipment and service from my friends at Aldon. 24-hour emergency service available. At Aldon, it's their commitment to continue providing above and beyond HVAC service for all of their customers. They truly care about the air you breathe. Call them today at 314-567-5585 or on the web, aldon.com. That's al-don.com, 314-567-5585. And welcome back, 745. Welcome to our spooky set. It's the Real Monica Adams Show with Dr. Richard Lehman from the U.S. Center for Sports Medicine. And literally, I was just going to ask this question, but Tina's in the other room wanting to know. I'm going to guess it. I know the answer. Are these procedures covered by medical insurance?
No.
I knew that.
And they will never be.
Never?
They will
Oh, my
never.
gosh. Why?
Well, I think, and I don't want to speak negatively, but I think insurance companies have taken a stand, and I think that they have decided not to cover any biologics, PRP, stem cells, etc. And my opinion is, and I could be totally wrong, it's just a financial decision. They just said, look, if this is an open black box, every doctor is going to be injecting this stuff everywhere. We have no control, we have no quality assurance, and we're just not going to cover it. It has never been covered. There have been articles, the FDA, we have spent unbelievable amounts of money and time trying to get insurance companies to look at this and cover it in special indications, torn meniscus, tennis elbow, patellar tendonitis, whatever, and they're just not having it.
That's unfortunate.
Yes.
And that's what frustrates so many people, because they are like, oh, well, I can have this drug that's thrown at me. I can have this surgery. That's all covered. But if I'm trying to be preventative, I'm trying to do everything I can, it's not covered by insurance. And there's a lot of times people won't do things because they don't have the funds.
Well, it's expensive. You know, a PRP injection's $550. It's expensive. In LA, it's $2,500. So yes, absolutely, and we shouldn't be making medical decisions based on finances, but you can't help it. I mean, if you can't afford it, you can't afford it. And most people, it's a stretch. So that's the first thing. The second thing is, if you're an insurance company, and this has always been my pitch, isn't it cheaper to pay, let's say you have 2 PRPs, so that's $1,000, than pay $30,000 for a knee arthroscopy, but no one's buying it.
No one's listening.
No one's listening. No one cares.
We do care. That's why we're doing this show. We're trying to change lives here. Rose says, Dr. Rick, I have so many replacements. I go off like the 4th of July going into the hockey games at Enterprise. Question, does RA and osteo shorten the life of replacement parts?
Yes. Well, OA, not for OA, but RA, the bone generally is a little bit softer, and the revision rate is higher in RA than in OA. So yes. And OA is osteoarthritis, RA is rheumatoid arthritis for everybody.
And what are your thoughts on holistic approaches to healing and inflammation?
I'm a big fan. You know, I think a lot of doctors poo-poo something they don't understand. And when you're covering the Olympics or World Championships and you're seeing doctors from really all over every inch of the world, they're doing some crazy stuff. So you have two options. One option is to say, well, they don't know what they're doing, they're crazy, and I'm right. You know, that's kind of short-sighted. And then the other way to go, which is kind of fun for me, is I just go up, talk to them. Now I've been doing this 40 years. I know them all. And see what they're doing. And a lot of like acupuncture, now we call it dry needling. It's just acupuncture. We've been doing it for 30 years. So all the things that a lot of these doctors are doing are eventually going to come to fruition. It's just they look at things a little bit differently. So we get in a holistic medicine. You know, what's different about it? Supplements, not doing something that the drug company's telling you should be doing. I'm a big fan.
I love to hear that. And again, it depends on the doctors you talk to, and I appreciate every aspect no matter what, but you have to do, ultimately, it's your decision. You have to do what you think feels right. Why not? But to me, it's always, why not? What's it going to hurt? Acupuncture, dry needling, chiropractic care, massage therapy, all these things that, you know, chiropractors used to be looked at as quacks. And then people are like, hey, chiropractors literally changed my life. What it does, not just for adjustments, but what it does for the organs, everything, that it's, you know, you have to be your own advocate. You have to make your own decision. Kathy says, I had stem cell taken from my hip and put in my shoulder and completely avoided surgery. That was about 5 years ago. There you go.
And you know, who doesn't want to avoid? I mean, most people want to avoid surgery. So again, Kathy, rock and roll. I mean, I think we're not doing this because it doesn't work. I mean, we're doing this because it does work. The one thing that's important is you have to have the right indication. So if you're just sticking PRP in every kind of thing, which is probably the insurance company's complaint, then yes, it doesn't work. You have to have the right indications. But degenerative arthritis, the most impressive thing, anti-inflammatories, cortisone, hyaluronic acid, all the others do not work as well as biologics.
I had stem cell for my knee in Dr. Lehman's office and have seen great results since January of 2022. This is from Kristen Helimachek.
Yes.
Okay. How long do you anticipate that would last, she says?
Well, it's hard to say. So, I wouldn't be surprised if in 2 or 3 years it got sore. And again, you have to step up and then get re-injected.
Cheryl asked, what does PRP stand for? I think it was a platelet-rich plasma. Are pregnant women able to donate the umbilical cord post-delivery?
Yes.
Oh, very
Yes.
good. I love it. You were going to talk a little bit, for those of you that are football fans, Aaron Rodgers, Achilles injury. I told you, I don't watch much news, so I didn't even know that there was one. But let's talk. So first of all, where the Achilles is, you know the whole, that's the whole weakness aspect. If you go way back in generations in history, that's their Achilles heel, right? That's their weak spot. So what happened with Aaron?
Well, so just walking it back a minute, 5 or 10 years ago, when somebody had an Achilles tendon injury, their career was over.
Okay.
And we repaired them all. No one came back. Wasn't great. We casted them for 6 weeks, 8 weeks, and it just wasn't a good operation. Wasn't a good outcome. And probably about 3 years ago, we started doing things completely differently. We started using augments to repair the Achilles. So we used stronger suture, and then we would augment this repair using something called fiber tape. Fiber tape is 2 millimeter wide organic tape. That's dipped in collagen, and you literally could pull 2 semi-tractor trailers with this stuff. It's very strong. And so what Aaron Rodgers had was an augment using fiber tape to enhance the strength of his repair. And he was shown the other night throwing a football on the field, and I think he's about 6 weeks out. And so his pitch, he plays for the New York Jets, is that he wants to come back and try to play at the end of the season. And I said at the beginning, if the Jets made the playoffs, which is probably, you don't follow football, but it's highly unlikely, then I think he has a chance of playing in the postseason. And maybe he will come back for a game or two at the end. I would say, as a team doctor or team owner, and I've been both, I wouldn't have him play if he were my athlete, and we weren't going to make the playoffs, so there was nothing to play for. I wouldn't have him play this year, but that's a decision their management will make. But he's doing unbelievably well. Now, having said that, Kobe Bryant had a similar procedure and came back. Kevin Durant, these are both basketball players, had a similar procedure. So this isn't new territory, really. I mean, in the last 3 or 5 years, this is what we've been doing. Our results have been unbelievable. But it's just a change in technology. It's an iPhone 20, not an iPhone 2.
Well, and as a doctor and as a prior team owner, you do have to, you toe that line. You've got the athlete who's like, I don't want to sit out for the season. This is my career. This is my life. I can't sit there on the sidelines and watch this. But you also have to weigh, all right, we're going to put you back in the game, and if it gets into the playoffs, you're going into the Super Bowl, you're going to the World Series, you're going to the Stanley Cup, then it's, all right, we're going to do this, but is it a career-ending injury, not just a season-ending injury?
And that's the fear. So let's say you bring him back just to bring him back, week 15, week 16, and the Jets aren't going anywhere. Why would you do that? It's an empty victory. Now, if it's showtime and it's a Super Bowl, and you re-tear it, then you re-tear it. It's a Super Bowl, and you can understand that. And it may be for him, he's an older guy. It may be career-ending if this repair fails. So you're 100% correct, but I think you have to titrate all that in making your decision. And right now he's making an amazing return, but no one really talked about Kevin Durant and Kobe Bryant. I think the PR has been much better for him than it was for them, because both of them had unbelievable recoveries.
What do you think? This is what someone just said. This is going to make you laugh. Monica, does Dr. Lehman think, in his medical opinion, that the hand creeping up behind him is arthritic?
I love that.
Yes, there's some serious problems going on there. A lot of your patients that are just saying how incredible you've been for them. Michelle, of course, is watching us from Malta, and you did her shoulder surgery. She said that you're fantastic. Now, I do have a client of mine, and this is when sometimes people might be listening going, oh, well, maybe I want to try this. We're not saying it's end all be all and that you aren't going to avoid surgery. Maybe that is on the plate, but if there's a way to try to avoid in every possible level, that's what he's going to try to do. Angie said, I appreciate all that you tried to help me. I'm continuing to focus on training to get stronger. You both are the best. This is Angie Workmeister, who is a patient of mine, a patient of yours, a client of mine. And here's the thing. She had to wrap her brain around, I have to have total knee replacement. And she's young. And I know you normally wouldn't want to do total knee replacement on someone so young, but hers was just, there's nothing else we can do, right?
Well, and I think everybody listening, this is a really important concept. So if you have no cartilage and you're bone on bone, shoulder, knee, hip, doesn't make any difference, you can try some of these biologics and you may get some improvement. But I think when your arthritis gets to a certain stage, then your options are to live with it, which is really not a good option. And the other option is to have an arthroplasty. Now, there's a very important point here, and the point is you go to a lot of total joint. I'm not a total joint guy. I don't do them. I know the literature. I don't do them. So this is going to be no skin in the game comment. When I think of people and they come to me and they go, look, I'm 50 years old. My doctor told me they want me to wait till I'm 65 to have my, let's say, knee replaced, hip replaced. I think to myself, the next best years of your life are the next 10 years, right? You're 50, you're going to be miserable for 15 years so that at 65, God spare your soul, you're going to have your total knee. And to me, that doesn't make any sense at all. So if I have bad degenerative arthritis in my knee, I'm 50 years old, my best 10 years, my next 10 years. So for people listening out there, you have to really think about it. Yeah, you might have to have a second total knee replacement, but why live 10 or 15 years of your best years miserably so that you can wait for this magic time when you're 65, which you may not even live to be 65? It doesn't make any sense. So for those people out there, really think about that. Get your knee replaced, get your hip replaced, whatever it is. The technology is going to change. We're going to be much better in 10 years at doing whatever we're doing. And don't live 10 years in pain just to wait to get your joint replaced.
Right.
To me, that's illogical.
Well, that's not truly living. And I mean, what a waste of 10 years. We're not promised tomorrow, Doc. Right? Okay, so Dr. Lehman and I have been talking for a long, long time about doing regular segments together. We've got a lot of things to talk about. I don't want to get into it today, but you know that I had that car accident 2 years ago. Still, 2 years later, dealing with concussion issues. And you're familiar with or friends with the guys over at Blue Tail Medical Group?
Very well.
So Dr. Chris Wolf, evidently, is very sought after, from what I'm told, all over the U.S. for concussion. I'm actually going to see him tomorrow. Great. I'll let you know how it goes. I want to bring you back for what I'm told about that, because there's a lot of people that deal with concussions. I still need to read the book. Someone, I think it's something on the lines of The Ghost in My Brain. Speaking of ghosts, the ghost in my brain, which no one can see what we're going through, but we know. And I came to you, literally, this is how much I respect this man. You were the first person I came to after the accident. And you looked at my cervical area and it was straight up and down. That kind of stress from that crash. So anybody that's been through any kind of trauma, that finally went and found its way back. But there's like crinkling that happens that I can almost like somebody's like taking a bag that I hear every time I do this. And then there's the double vision. There's the nausea. This is the weird thing. And so if somebody came to you and said, I feel like, depending if I have my head up this way or my neck down this way, that it feels like a little worm, like it's a little electric current, that would be possibly...
Well, so all these things are very consistent with post-traumatic concussion syndrome, and when you're a sports guy, if you think about contact sports and hockey, football, lacrosse, there's a lot of them, the concussions, diagnosed and undiagnosed, are through the roof.
Yeah.
So then you take car accidents. Well, how many car accidents do you think there are in the United States every day? There's thousands.
Right.
So if you think about the number of people walking around out there that have post-concussion syndrome, the number is insanely high. We don't know that much about it, just to be fair, or how to treat it. It's not like, okay, go take this pill and it's going to go away.
Right.
2, does it last 2 weeks, 2 months, 2 years, 20 years? We don't know. We have no test to say this is it, this is better, and this is working. And lastly, and maybe most importantly, there haven't been really any, since there's no way to test it, there's no really good studies that tell us this is how you treat it. So we're a little bit in the dark. Now, post-concussion syndrome in my practice like the common cold. I mean, I'll see NFL guys, they're 31 years old, they had 7 concussions playing in the league, and literally they have a piece of paper telling them how to get from my office to the airport because they can't use the GPS because, they just can't mentate. So this is a big problem. And, you hear about Joe Louis, who was quote-unquote punch drunk, or, this athlete but all these post-concussion issues, boxing, of course, should be outlawed, is very common. It's just hate to say it, we're dumb. Doctors are dumb.
Well, you have to see the movie, by the way, with Will Smith about concussions, because it really gives you a wake-up call. And then you think about the athletes on, again, many levels. I remember my nephew getting concussions in high school and just how dangerous. And you just mentioned 7 concussions. That's not something to let go. You think of how completely it changes their lives. And then that has brought about the whole aspect of people talking about how it affects them on so many levels that you've seen them taking their own life.
Absolutely.
Right? And that's discussed in that. I want to bring you back many times. We want to do a segment together on a regular basis. If there are things that you would like for me and Dr. Lehman to discuss, let me know. I'll reach out to him. Rick and I have been talking about doing a regular segment for a long, long time now. So I am going to bring you back on once I get what they tell me tomorrow. I'd like to go a little bit more in depth with you on that. So I end the show every Monday and Tuesday with a devotional. I'm going to let you pick shame. So it's 100 days to freedom from shame, overeating, which we've discussed today, depression, anger, or fear and anxiety.
I think we have to go with anger.
Anger. All right. We're going to go to the anger one. We will be back to wrap up the show. 100 Days to Freedom from Anger right after this. Think about this. When's the last time you called your doctor at 2 o'clock in the morning and he actually answered? Well, at Innovare Health Advocates, their patients are special. Their doctors, nurse practitioners, their care team care deeply about your health, your family, your work, and even your pet. Their clinicians are accessible and they lead your care in and out of the hospital. In fact, Dr. Charles Willie offers his cell phone number to his patients to ensure they can intervene early in your illness. They can provide care above and beyond, offering lab, x-ray, echocardiogram, and other treatments in their office. Innovare Health Advocates with 5 locations on both sides of the river. Check them out, innovarehealth.com. Envita Health and Wellness, where you can feel your best both inside and out. Envita isn't your typical med spa. They're a multi-specialty medical spa and wellness center serving St. Louis and its surrounding areas. They have ketamine for mental health and pain, IV therapy, medical weight loss, and aesthetics treatments. As board-certified anesthesia providers, Envita can ensure that their advanced treatments are provided safely with minimal to no pain. So let Envita take care of you. Call 314-394-0950 to book an appointment or online envitahealthandwellness.com. Welcome back. We are in the final wrap-up of our show, and we're talking about 100 Days to Freedom from Stephen Arterburn. This one, Dr. Rick picked from anger. It's called Be Free. Therefore, since we are surrounded by such a huge crowd of witnesses to the life of faith, let us strip off every weight that slows us down, especially the sin that so easily trips us up, and let us run with endurance the race God has actually set before us. This is Hebrews 12, verse 1. So is there ever a good use of anger? Well, of course. Think about this. Anger is an internal alert system that warns us something's wrong. It could be a response to injustice or an alert to problems that need to be resolved. Anger becomes problematic when we become vigilant or aggressive about righting this particular wrong. However, when we can channel the energy that anger provides, we can make changes that actually benefit others. The challenge is to use that emotion for good, not actually get trapped by it. Anger actually can be a powerful force. If you have ever felt rage or been in an agitated state of frustration, and who hasn't, you have felt the sense of relief that occurs afterward. Some people actually use their anger as fuel to accomplish whatever task is in front of them. I use anger and go to the gym, and that's my fuel. In sports, a mistake or a poor call by a referee can actually provide fuel, right, for the best players to perform even better. So how is anger manifesting in your life? Do you feel like you're in competition with everyone and everything? Or are you able to channel this alerting anger to achieve positive change in your life. When something angers you and you identify the wrong, you can take steps to make the difference needed in whatever the situation may be. Anger isn't an emotion to avoid or negate. Instead, understand how it works and then control it. As you encounter situations and people that arouse the anger, don't let it trip you up. Alexander Pope said, "To be angry is to revenge the faults of others on ourselves." And the great Billy Graham, "Never underestimate anger's destructive power." Today's prayer: Lord, you know how frustrating life can be. Help me to channel my anger to bring about good in the world. Help me to not give in to the emotional outburst, but rather submit to your will in all things. Help me to be free to accomplish the purpose you have for my life, that it may bring glory to your name. Amen. I tell you what, Rick, every single time my guests come in here and they pick which one they want, and I never know what you're going to pick, it always is so fitting. We even talked about sports in that one. That's kind of crazy. All right, last comments. Love hearing different perspectives from doctors on health and fitness. And again, just so many incredible things that we have to talk about in future shows together. Thank you so much again, my friend, for coming in.
Thank you for having me. This is always just, it's so great to get, information out to people, because the information changes.
Always. I mean, here you are saying, we can look years ago, and even he and I have been talking a lot about blood flow restriction therapy, stem cell, PRP, and then here he is saying, yeah, we got this. This is exciting. We got this coming, even the next couple of months and into next year. So that's why we will have him on regularly so we can discuss that. Thank you so very much.
It's great.
And to all of you, thank you. Remember, I end every show the exact same way. Go out, see the vision for yourself. Go out and be anything you want to be in the world. But before you're anything, be kind to each other. God bless you.